The United States is facing a growing health crisis as measles outbreaks surge while vaccination rates decline, a situation that experts warn could have devastating consequences. Since the beginning of the year, more than 130 cases have been reported in Texas and New Mexico alone, a troubling sign of what some infectious disease specialists call a looming catastrophe. Dr. Paul Offit, a leading pediatrician and vaccine expert, has sounded the alarm, stating that measles outbreaks are a clear indicator of a failing public health system. Other medical professionals echo this concern, emphasizing that measles is not just a childhood illness, but a highly contagious and potentially deadly disease that can lead to severe complications such as pneumonia, brain swelling, and even death. Despite these warnings, newly appointed U.S. Health Secretary Robert F. Kennedy Jr. has downplayed the situation, insisting that annual measles outbreaks are nothing unusual. However, this stance is dangerously misleading. Prior to the COVID-19 pandemic, measles have been nearly eradicated in the U.S. thanks to decades of successful vaccination campaigns. Now, declining immunization rates, fueled by growing distrust in public health institutions and pharmaceutical companies, have reversed this progress, leaving vulnerable populations, including young children and immunocompromised individuals, at significant risk. The consequences of vaccine hesitancy are already evident. A tragic case in Texas recently underscored the dangers of measles, as an unvaccinated child succumbed to the disease, a death that could have been entirely preventable. Measles is one of the most infectious viruses known to science, spreading through the air and remaining active in a room for up to 2 hours after an infected person leaves. Even brief exposure can lead to infection, making high vaccination coverage essential to preventing widespread outbreaks. Yet, vaccination rates have plummeted, with some communities reporting measles immunization levels below 90%, far below the threshold needed for herd immunity. Kennedy's history of promoting vaccine skepticism only exacerbates the crisis. Over the years, he has propagated numerous false claims about vaccine safety, including the widely debunked theory that childhood vaccines cause autism. More recently, he referred to COVID-19 vaccines as the deadliest vaccines ever created, a statement that contradicts overwhelming scientific evidence demonstrating their safety and effectiveness. His appointment as health secretary raises concerns among medical professionals, who fear that his influence will further undermine public confidence in vaccines and lead to more preventable illnesses and deaths. Immediate action is needed to prevent measles from spiraling out of control. Health officials must ramp up vaccination campaigns, counter misinformation, and ensure that accurate, science-based information reaches the public. Parents should prioritize getting their children vaccinated, as skipping or delaying shots not only endangers their own families, but also contributes to the broader public health crisis. Medical professionals must also remain vigilant, identifying and isolating measles cases quickly to prevent further spread. The resurgence of measles in the U.S. is not just a temporary setback. It is a warning sign of a weakening public health infrastructure. If vaccination rates continue to decline, other preventable diseases could make a comeback, placing countless lives at risk. The consequences of inaction are clear: more outbreaks, more hospitalizations, and more preventable deaths. The time to act is now, before the situation becomes unmanageable.